I'm so glad to be here today. So as Julia mentioned, I'm going to be talking and presenting some information and basically some of my thoughts around the adoption of COVID-19 contact tracing apps. So arguably, one of the most important and maybe most debated smartphone applications that have ever existed for health are contact tracing and exposure notification apps that have sprung up due to the pandemic. And just a quick disclaimer is that, I'm speaking on my thoughts. I'm not involved in development or implementation or evaluation of these apps. However, it relates quite directly to my research interests around mobile health. And so I've been keeping quite a close tab around this topic. So first of all, there are lots of different types of COVID-19 apps, and some fall under real contact tracing apps, and some of them fall under exposure notification. And so the important distinction here is that for exposure notification apps, you don't really know a lot about the individual. So you don't know who is being in contact with. You don't know where the contact has happened. And obviously this is done to protect privacy. So with true contact tracing apps, you have a lot more information about the individual. So you actually know who and where people have been. So obviously it's less private. And there's a lot of different types of technology that can be used, and how they're used is dictated by a country's kind of own culture and their own values. So let's take a look at a few, maybe some dichotomous examples. So China has been in the news quite a bit, and I quite like this quote from a news article where they say that the app is pretty much controlling the life of the citizens. And so they have taken quite an extreme stance on using an app such as this. And so basically what happens is that each individual citizen has their own QR code. And there are also QR codes posted around the different locations. And there's checkpoints. So basically to get anywhere, including the subway or stores, restaurants, you have to show your QR code. And they are color coded so that green means you could enter. Yellow means that you have to be quarantined for seven days. And then red means that you could be quarantined for 14 days. And at some instances, you're quarantined actually in a government institution. So you definitely don't want to see that red. And so part of the issues here is that the algorithms that generate these codes are not available. And so it's a little bit opaque how you're getting these codes, colors. And it has been reported that some people get red and you don't even know why. So that has been a bit of an issue. Another example, which is kind of an interesting hybrid situation where they use required and voluntary apps, is in South Korea. And they've been quite open to the public around the different data sources that they're using to track the citizens. So they have phone location logs. They even track credit and debit card transactions to follow people. And they actually have an extensive network of surveillance cameras that they use to really follow where people are going. They've released a lot of this information about people who have COVID-19, have been tested positive, to developers, and they have created a number of different apps. One of the very popular ones is called Corona 100 meters or 100M, which is an app that shows if you're within 100 meters of someone who has tested positive for COVID-19. And so you could see if there's a lot of people who have been tested and positive, you may want to avoid that area. A app that translates to self-quarantine safety protection app is also very interesting in that while they say it's not mandatory, it's pretty much required when you come into the country. So even if you're a resident or a visitor, they direct you to download this app. And it basically is telling you the location of where you are. So after 14 days, when the quarantine period is over, the app says you could delete it. So while they say it's not mandatory, you're directed to use it. So it's sort of mandatory at that point. So let's look at the other extreme now. So in Canada, as you probably know, we have the COVID Alert app, and it was launched at the end of July. And it uses a neat way of exposure notification. So through Bluetooth, low energy, and I'll talk a little bit about that in a second. And importantly, it employs the Google and Apple exposure notification API. So Google and Apple, they got together and they created this API, which solved a lot of the problems that was happening when they were when other countries were using this technology at the very beginning. So one of the main problems was the battery would go dead because the app would have to run in the foreground. So with this new API, the apps can run in the background. And again, it solves a lot of these kind of issues. So you may already know how it works, but I think it's kind of an elegant and kind of like a very neat way of protecting privacy. So I'll just spend a minute maybe talking about how the Bluetooth low energy system works. So here you can see two people, Alice and Bob. They are meeting. They're within 6 feet from each other. They have a conversation that's longer than 10 minutes. They both have phones with the app on it, and the phones basically exchange what's known as identifier beacons. So they're random strings of numbers. And what's neat about this is that the numbers keep changing every 10 to 20 minutes. So it's not as if you're assigned one number and then people can track where you are through this number. So after they've swapped these numbers, a few days later, Bob has tested positive for COVID-19. Then he can choose, again, it's voluntary, to upload your information from your phone. And it basically sends 14 days of the keys that's been stored in the phone up into a data server that is owned by a health authority. So now Alice doesn't know that she's been in contact with anyone who has been tested positive, but her phone is receiving these strings of numbers periodically. And if there's a match, then you know that she's been in contact with someone who has tested positive. And the app will then give an alert, and it will tell you what to do next. So that's basically how it works. So I just want to highlight here, what's interesting about this is that there's a lot of privacy and security measures that were built in. First of all, the users opt in, so it's completely voluntary, and they could stop to use it, and they could turn off the Bluetooth at any time. There's also no information about location or any identifiable information at all. Also, the data stays on the individual's phone. So unless they're tested positive for COVID-19 and choose to upload some data, the government does not have any data at all about each individual. And then, as I mentioned, the beacons, again, change every 10 to 20 minutes. So it's not as if you're stuck with one identifiable number that people can track where you're going. So is the app being used? As you know, it started out in Ontario, was developed in Ontario. Now many of the provinces are now using it. As of mid-October, there were 4.5 million downloads, and a lot of these have been by people in Ontario, as it's been the longest used in that province. So if you do kind of like the back of the envelope calculation, you're looking at somewhere around 20% of the population downloading the app, and maybe up to about 30 if you kind of take out the people who can't download it. There's been over 1,100 times where people who have identified as being positive for COVID-19 who have uploaded their information, which translates to about 5% of the cases. So why hasn't the app kind of taken off in a larger way, or why hasn't it been adopted more? Well, obviously, first of all, not everybody has a smartphone, right? So you're looking at about 10 to 20% of the population who just don't own smartphones. And so that population obviously cannot use it. And then in the media, you probably heard that it only works on newer phones. So it has to be within about 5 years. It's still a large proportion of people who have these phones that do work, around 90%. But the criticism really is that the people who have the older phones are likely the people who maybe need it the most because they live in the kind of lower income areas. One other problem around technology, which is not so much in the COVID alert app that we have right now, again, is the battery draining issue. And still, there are a lot of bugs that have been reported in different apps around the world, such as having alert that stays on the app that you can't try to get out. I think this kind of interesting solution that Singapore used to try to alleviate the problem of people who don't have smartphones or newer smartphones. They started giving out these tokens. They call it the Trace Together token. It works similarly to the way that I described through Bluetooth. And so the device, it sends out and receives these Bluetooth beacons and stores these numbers. And you would basically have to send it back to the government if you've been identified that you've been in, if you are tested positive, and then they upload this information. So again, it's kind of like an interesting way of trying to help the problem where people don't have smartphones or do not have newer phones. So other adoption barriers, one of the things that you can look at it in two different ways is the apps are generally sent out by the government. And some people think, well, because it's from the government, it's trustworthy. If you look at it from the other side, some people think because it's from the government, I don't trust it. And so it's just kind of like a point of view. Also, many people still do not want to download it because they're concerned about privacy. So even though, you know, the COVID alert app has been really vetted a lot through different levels of privacy commissioners, like federal and provincial, you know, all the information is actually online. You can take a look at the reports, how it works, the privacy measures. There's still going to be a percentage of the population who are concerned about privacy and won't download it. Another point I wanted to make was around the features. So the COVID alert app really does one thing, right? It alerts if you've been exposed to someone who has tested positive. Other countries have used this opportunity for apps to have added value by putting other features, such as being able to get your test results through the app. So this is what Germany did. In the UK, they have apps that have like a number of different features, including scheduling tests. They have symptom trackers. You know, you could get the results, etc. The third point here is around kind of ease of use and effort. So while many of us probably wouldn't find it very hard to download these apps and to use them, there's, you know, if you can imagine people who are not very used to using smartphones and don't feel comfortable or finding the app to download. So there is just still this element of making it easy to use. And what was interesting was in middle of August or so, there was a study done by Main Street, and they did this telephone survey of 1,600 people in Canada. And they found that nearly half of the Canadians said that they were going to download an app such as this. And in Ontario in particular, there was even a higher percentage where 72% said that they would either download it or have already downloaded. So it's kind of interesting that we haven't quite even nearly actually reached that kind of level, even though there was it seemed that people were willing to do it. And maybe it's around, you know, the effort of actually just even finding the app and, you know, perhaps even having another blast where there's a link to the app may be helpful. The final point I wanted to make around adoption barriers is the lack of evidence of the effectiveness of the app. And it really is a catch-22 here, because people don't want to download it because they don't think it's effective, and it's not as effective if people don't download it. So it's this kind of like weird situation where it's kind of like a chicken and egg situation happening. So what has happened is there has been efforts in trying to promote and increase adoption. You may have heard that or seen around several influential brands being helping to kind of spread the word. So here you can see a Maple Leaf spreading the word through a tweet, and he has a little video talking about why you should download the app. Also, the government has put out these promotional packages, and they are available in terms of videos and posters. So you can imagine if a restaurant, if you owned a restaurant and you wanted to promote it, you could literally download a poster and use it quite easily. So these are all great ways of trying to promote the app, but in comparison, it's not as much as what other countries have been doing. And in particular, I found what they're doing in New Zealand very interesting. They actually have this this show, which I've never heard of before, but it's very popular in New Zealand, where it's a comedy. And they got the stars from this TV show to make a series of skits about different topics around COVID-19. And there's one around the apps. It's basically posted that people can watch, and it kind of gets the word out. They also asked filmmakers to create funny videos, and they had 500 different videos being submitted, and they posted 50 of them. So this may have helped with the adoption of these apps. They had over 40% adoption rate by even early September, which is very good. You can see that the image here on the right, this is something else that they did, where when the country locked down everything basically, and people couldn't leave their homes, the only time they went outside was to take out their garbage. And so this is a grassroots movement where people started dressing up in different ways and taking photos and posting it. And so here you can see a couple of twins kind of dressed in kind of a creepy sort of way, and again, kind of inserting a bit of humor to kind of get the word out, and to just get people maybe like a better kind of mood. Okay, so is the app effective? So that's actually kind of a hard question to answer. For one thing, there is very little evidence, right? And right now, I haven't seen yet an evaluation plan that has been released. There's the evidence that we have is very anecdotal. And still there's some good stories, and you hear stories, for example, of a teacher who got alerted from the app. They went and got tested, and then they themselves modified their behavior so that they wouldn't spread it further. But in reality, there is very little data. We know things such as how many downloads there were. I mentioned already how many cases that were uploaded in terms of people being tested positive for COVID-19. But really, that's about the extent of the information that we have at this point in time. And the reason why we have very little information is really this balance between privacy and how useful you want this app to be. And you could look at the usefulness in two different ways. One at the individual level, where, for example, you're not given a lot of information about who has COVID-19, right, that you've been in contact with. So you don't know where you were in contact with them. You don't know who that person is. You do know that it was within the last 14 days. But it doesn't give you then a lot of context in terms of, where's PPE being used. If it was 14 days, maybe you only have like 1 or 2 days where you would have to be more careful, versus if it was, in the past couple of days, then you have a longer term where you have to be extra careful. In terms of the usefulness as well, because we don't have a lot of data, we don't have a lot of data to analyze to determine how effective this was. And so, one of the things that some countries did was have a centralized system where the data is actually stored in some kind of server owned by the government or accessed by the government. But again, this is a trade-off for privacy. So Germany was going to have this centralized system, but as it was being developed, there was quite an uproar in terms of people not wanting this data to be stored centrally, and so they went to a decentralized model. So we can't really tease out the impact of these apps on, the numbers of new cases of COVID, but you could certainly make some inferences around what's happening and potentially see that the apps may have an effect. So, I talked a little bit about Canada and Germany, and you can see that, everybody has seen these graphs where the second wave is quite high in terms of the new cases per day right now. So you contrast this with a country like South Korea, where things have been there's more data, and again, probably at the price of privacy. But you can see that the second wave hasn't happened the same way as in other countries, and even in New Zealand, you can see that the numbers are very low still. And again, that has a lot probably to do with the fact that they locked down the country. But again, you could try to make some inferences around the impact of the app. So I just wanted to touch upon the 60% adoption rate debate. So there was an interesting study that was done in Oxford where they modeled a number of different scenarios, and they found that they can stop the epidemic if approximately 60% of the population use the app. And this is in conjunction with other measures, obviously, and even a lower number of app users would still have a reduction in the number of COVID-19 cases and deaths. And so, and in fact, they found that even with 15% of the population using it, you have a reduction of infections and deaths by 8 and 6%, 8 and 6% respectively. And again, this is in conjunction with other, manual contact tracing and other measures. But what was interesting is that you probably heard the 60% number, and the media took that number and forgot about the second part of the sentence, and too much to the dismay of the researchers who did this, they kind of like just promoted the 60%. But I think it's good to remember that even much lower numbers can have an effect. So I'm just going to wrap up by saying, whether or not, in my opinion, it's kind of worth it. And it's really quite an individual assessment based on your own feelings around the cost versus benefit. What we do know right now is that manual contact tracing is lagging behind. We don't have enough people doing it. It's highly, time involved, and it takes a lot of people, and they're hiring new people, especially in certain pockets for manual contact tracing. So there is an argument that something like digital contact tracing may have a very significant impact, especially at these times where the numbers are so high. So I think that's it, and I think I have a few minutes left for questions at this point.
Emily, thank you so much. I think actually part of the answer to the first question may have been in your last slide, but Simon Bacon is asking, what role does the more traditional contact tracing process play with the introduction of the app? How much of a parallel process do we need? And I actually had some questions about that as well, just thinking of, everything from the paper in the restaurants that we're putting our numbers on to other more manual processes. Is it comparable? Can you draw similar inferences? Are you able to track, and you did point to this in your last slide, but I'm curious also about the privacy perceptions around that sort of manual tracing. So a few questions in there, but I think along the same vein.
Yeah, so thank you for that question. I think that, to keep in mind, the digital contact tracing was never supposed to replace manual contact tracing, right? So it was never, the intent was never that. And so this is like an added layer onto it. And it was always meant to be done in conjunction. So, and again, most of what we're doing is actually exposure notification. So it's not even contact tracing, right? So in Canada, I think that's, again, an important distinction, is that it's giving information to the individual for them to make a decision versus, getting information about the individual and then pushing out and using it for contact tracing. So it gives the individual some information. So for example, if you are feeling slightly unwell, you may not want to go get tested, right? But if you get an alert saying that you've been in close proximity with someone, that may give you more information, right? So it's all about giving more information versus replacing. And again, manual contact tracing is absolutely essential in my opinion, and I don't think anybody is disagreeing with that. I do think that as the numbers have been getting so high, and you're hearing situations where you're not getting timely manual contact tracing, getting information a day or 2 or 3 or how many days earlier that you may have been exposed and then you're going to get tested, I think is a good thing, right? And so again, I think that it's kind of like hand in hand that they would work together. And I think your second question was around privacy and the perception of manual contact tracing. And it's interesting. I mean, there was a lot of discussion around the privacy around digital contact tracing, but not so much about manual. And I think people are just kind of like, it's kind of what people are used to, right? And I always think it's kind of perplexing why there was so much interest, and I understand that, privacy is very important. I agree. But people who seem to have no issue about using Facebook or tweeting where they've been or when they go to Starbucks, right? Suddenly they're worried about these anonymous strings of numbers being stored on people's phones. And so I think it's kind of like what's new and what's being what people are used to. And so I haven't actually heard of any issues with people, having, saying I don't want to have manual contact tracing because of privacy.
Yeah, and yet it overlaps interestingly, for example, in the restaurant example, with universal identifier conversations and dialogues that are ongoing, and the concerns around those, which are fairly broad and deep, I would say, as opposed to the checks and balances that you were describing being built into the actual contact tracing. And so I think one of my questions, building on that, and actually building on a comment that also Simon Bacon made to the group, which is this is a perfect example of where the behavioral sciences need to be front and center in the push to get on top of COVID-19. So given the complexity of really, interestingly, what I would argue from an informatics perspective is almost safety catches built in, and the complexity of that message. How do we actually move that forward to change behavior? I liked the the push through the leafs and et cetera. But how do we need to actually further clarify the strength, I guess, or the security around the app, or is that the wrong message? Is it more just a need to push out the invitation to join the app itself? What's worked in other countries, for example?
Yeah, and I think you make a really interesting point. I mean, there was so much talk about the privacy issues at the beginning when this came out, and I try to outline that there really is, like, this is such an elegant way of doing it. I can't even see how, I mean, the privacy breach would be so difficult to have. I mean, there really is no data, right? And so I think that messaging has to be out, and I think that has been actually done relatively well. I try to explain it, and it is a little bit confusing. It takes a few minutes to really understand what's happening. And even this is a simplified version, because actually in the background, it's actually more complex. But, to your point, I think that, messaging is super important. And, can Canada do a little bit better? Perhaps, right? Like in terms of marketing, getting some kind of, they're using some of the brands as I mentioned now, but I think more can be done around that, and as well as in terms of even maybe hiring people who actually do this for a living, right? Like how do you market this properly? How do you make it so that it's on top of mind, right? And again, I point to New Zealand, who did some kind of novel things, right? And I think we could potentially think about how to do that as well.
Yeah, and maybe think about it systematically, because those novel things that come to the surface aren't always indicative of, they may be just part of a bigger plan. They're not, there maybe many novel things, but hope that something will rise to the surface isn't really a marketing plan. So thank you. Thank you very much, Emily. Thank you all. And for the good dialogue we have in the chat, means to get the Canadian app. And Emily, keep doing what you're doing. Thank you so much.
Thanks for having me. Great to see you.